What is the most common dinosaur in dentistry? Well, over 80% of offices still use paper clips and old paper forms. It's time to bury that dinosaur and move to Opera DDS Forms, where for as little as $59 a month, you can get all of your forms online. We've got a slick form editor where you can create your own forms. There's just absolutely no reason to stick with the old school ways. Avoid all the half solutions with PDFs online. Get yourself true paperless forms, any form, any device, anywhere, starting at just $59 a month. Go to forms.operadds.com. Welcome to the Operatory Podcast, the podcast about burying the dinosaurs in dentistry, moving past outdated technology and procedures to find a better way. As always, with me is David Pryor, providing the most crucial patient perspective. Thanks for being here, sir.
Hey there, Bryan.
Hello. It is a snowy day here in Minneapolis, so thanks for joining me today, sir.
You got it.
Well, I have, as we like to say, in addition to providing patient the perspective, you provide the blank slate.
Oh, yes.
Right? The open pasture for which thoughts to land on. And so as always, I put you on the spot. Not always, but today I'm putting you on the spot once again with a question of which you don't know is coming your way.
When do I ever know when the question is coming? I've never known.
The blank slate.
Yes. Okay,
yes.
so it's always.
Always.
It's always.
Always.
Okay, hit me.
Yeah, it's always. So you know, I know that there's a lot of dentists out there whose practice isn't thriving the way that they would like it to.
Oh, yeah.
Right? And there's people who are sitting back going, my practice is not quite where I want it to be. And I would put some thought into this recently. And I was thinking, what is the fastest way to grow your practice? Generally speaking, now we're not talking about any specific, like one thing, but if you had been plunked down out of dental school with all the knowledge of dentistry, and somebody gave you a practice that was not where you wanted it to be and said, what's the one thing that you can do to grow your practice?
So blank slate wise?
Blank slate wise. Unfair question.
It really is.
It is. I put you on the spot. I'd love to say that I don't like doing it, but it's fun to watch you squirm, my man.
Audience know that I get him back later. So,
yes, and while I'm doing the intro too.
Right.
Yes.
Yeah. I would guess if I were to take a guess. I mean, easy answers are things like marketing, certainly, partnering up with a DSO, creating more efficiency in the practice. A lot of doctors that I talk to seem to be running around like a chicken with their head chopped off. They can't keep up with what they're doing.
Yeah.
And so creating efficiency is probably the biggest thing I can think of.
Yeah. And so, I love everything you said.
Yep.
And it's all true. I'm thinking sort of bigger picture, and I'm not going to make you squirm anymore.
Okay.
As much as I would love to, I'm not going to.
Okay.
Because it wouldn't be fair to our audience because they can't see you squirming, which is really the real joy of it, right? You can't on audio see the uncomfortableness. Maybe it comes through. It might come through, but it's the fastest way is to follow the path of those that have done it before.
Oh,
right.
Sure. Yeah.
So if there is efficiencies, like you so wisely said,
Yep.
or if there is marketing to do, what is it that works? Well, you could figure out yourself, in which case, like any normal human being who does not follow what other people have done, you will make mistakes and you will go down wrong paths, or you could talk to those who have done it before.
Yeah. Yes, I would agree.
Yeah. I mean, you can probably think in non-dental world, there's probably a way where you said, well, I'm going to buy a car, right?
Right.
Well, what am I going to do? You don't just go out and like drive every single car out there. You don't research the combustion engine of the Honda Civic. You what you do is you read reviews. You really follow the pathway of people that you trust before.
Mm-hmm. Yes.
And that's the way our world is. We've talked about reviews on the podcast before. The vast majority of our patients look at reviews before coming to your office today.
Right.
And then really all they're doing is they're taking other people's experience so they don't have to have the negative ones themselves. is really what we're looking for. But the reason why I bring it up is I don't think that that's as common in dentistry as it used to be. And when I got out of dental school, there were these organizations like the Dawson Institute and Frank Spear when he was doing his thing back in the day, and these dentists who were very successful, who were who were like sharing their knowledge. And I don't see that as much. I don't see as many uber successful dentists actually sharing the knowledge as they have in the past. And so that's one of the
interesting, since it's so much easier to communicate now than it has been in the past.
Totally agree.
Yeah,
totally agree. But there's a lot less. I'm trying to be a little bit political here. I think there's people who maybe aren't as successful sharing their knowledge. Does that make right?
Okay, so
yeah,
I don't.
People who like to speak or like to. It's not just like, oh, I've done this, I want to pass it along. It's more like I'm passing along information that just came out of my head.
Okay, so audience know that I truly am the blank slate on this, so I don't know where Brian's going with this. But what
else is new?
So I'm going to ask this question. So speak to me on Dental Town or a similar type medium as to how you think that things are different today than they were back then.
Absolutely beautiful example, because I love Dental Town. Yep. It's great.
Yep.
It's a fantastic open commentary.
Yep.
Right? And if you go on there and you say, hey, I'm doing a veneer case for the first time, who can give me an opinion? You know who will give you an opinion?
Everyone.
Anybody. Yeah. Not somebody who's done 40,000 veneer cases. They're busy doing veneers, right? Now, I'm not saying that the information you won't get there won't be valuable. What I'm saying is that the value of information is not always coming from the person who's most successful or most knowledgeable about that, right? There probably is somebody who has wonderful cases on presentations on veneer. I just can't even tell you who it is, right?
Okay.
And so considering the source is important. Don't just post. Maybe that's why. Maybe you just hit. Being the blank slate, you came up with the answer to the question, because anybody can give you an opinion at any time. Nobody's experience is really that. Nobody really looks at the source of the information that it's coming from. If Peter Dawson were like coming out today, and he's, you don't know his name probably, but he was a dentist who really pioneered your bite, like occlusion and your jaw pain, and that he had sort of a narrower band of kind of he talked about everything, but he was known for a narrow band of clinical care. Whereas if you posted that same question that people would ask Peter Dawson 30 years ago on Dental Town, his comment would be they're buried in everybody else's comments.
Okay.
Right. And maybe that's why, the same thing. If I went on there and I said to your car, you can go on Dental Town and people say, what car should I buy? Mm-hmm. Why are you asking a bunch of dentists? It makes no sense. You should ask somebody who knows about cars.
Oh, I'd ask dentists.
You would?
Oh, yeah.
Oh, really?
They can afford cars.
Well, probably the reason why not to ask dentists, because they're buying cars that are like mine. That's expensive and is going to the shop in a couple days. So we are the wrong people to ask. You once again, my blank slate friend. Point made. Thanks for that one. But the kind of directionally where what I'm doing is we've launched Upgrade Dental, which is my version of what I think that we're really good at, which is technology selection and implementation. How to take something, how to make change in your practice or technology in your practice, how to select it, what to select when, and how to incorporate it into your practice successfully, to the point where like how to talk about any technology with patients, with your team. Because I think it's missing. I think that you go to a trade show and you'll see a 3D printer and you'll see digital x-rays and you'll see a CT scan. And the salesperson, each of those is trying to sell you that particular technology. And obviously they're getting some financial incentive to probably sell you that particular technology at that time. And they sell you on the benefit, not on what we call the cost of upgrading, that barrier that you have to go through where you slow down and have to learn to become better at the end. And because I think in general in dentistry, people are not following the success of others. They're trying to do it on their own versus listening to people who have done it before. Really, what I would kind of the message of this podcast to our audience is, if there's something you want to do, there's people that have walked the path before.
Yeah.
And follow them.
Yeah.
That's what mentorship is about. It's and in dentistry, I guarantee you, there's my suspicion too is that if there's a dentist that's down the road that has a practice that is thriving, you're like, I wish my practice were like that practice. Chances are, if you contacted that dentist, they'd probably tell you everything that they're doing, right?
Yeah. Well, having taken a brief look at the upgradedental.com website, I really thought that it was really well organized and gave a lot of great information in a short amount of time. And I guess to your point about, just looking at crowdsourcing an answer to a question probably isn't always the best solution.
And you don't know where it's coming from.
Right.
I hear it all the time. Dentists are shy away from technology because they've tried to implement something and it failed. That was the most expensive paperweight I've ever had.
Right.
Right. Or they look at it and they go, oh boy, you're gonna laugh at this one. Boy, I think this is amazing. They bring it to their office and their team is like, there's no way we're doing that. Right.
Yeah.
I mean, it's just some of the mindset is ridiculous of our team and of the dentists and of patients. And so it's and I get it if it's challenging and you don't know where to start. And so we've just developed the roadmap of literally the roadmap of growth, what you should implement when, in what order, and how to do it.
One of the things that, so I went through the first 5 or 6 videos, and one of the things.
Thanks for stopping, by the way. Yeah, appreciate that.
Yeah. Well, one of the things that I really liked about it is that where you started was explaining how to sell this to the rest of your practice.
Oh yeah.
And so you're not going to be successful with any of it if you're not able to present to your practice how to implement these different technologies. And so that I really thought that part was genius.
Well, here's the thing. A lot of the stuff that you put in your practice is going to be great for patients.
Yeah.
It's going to be great for the practice.
Yeah.
Your assistant, however, it might be a pain in the ass for.
Right.
At least initially.
Yeah.
Right. You get a CAD CAM system and suddenly she has a new job that she never signed up for.
Right.
Right. So you better figure out how to explain to her why this is in her interest or his interest, or you're going to have a paperweight. Right.
Yep.
You're exactly right. And same thing with the patients. I think that dentists try to describe to patients from their perspective the way the technology is. Oh, look, we have a CT scan so you can see your mouth in 3D and blah, blah. They don't care.
Yeah.
It's what does it actually, it means that your implant is going to be way more accurate when I place it in your head.
Yeah.
Right. Stuff like that. I mean, that's an oversimplification, but how to communicate the technology is key. Also what to do when, if you don't have digital x-rays, get those first, right? It's 1.1. That's where you start, right? If you don't have digital x-rays, don't get a CAD CAM system.
Yeah.
Get digital x-rays first.
Yeah.
If you disagree with me, please let me know, but I can't imagine a world where you're using film x-rays and CAD CAM. It just doesn't make sense to my brain.
Sure.
Right? And so we have that roadmap set out for you because obviously for me, starting off with the easier stuff that's going to build the capital and the confidence to get the bigger stuff down the road, that's key. So knowing what to do and what's up, that's why people stop. They go too far ahead, and this thing that's difficult to implement, either to communicate, it fails, right? So building up the lower steps is key.
I agree. My brain just went to video games on that one. If you skip a bunch of steps, then you're going to get too far ahead of the technology curve, and you're going to get squashed. So
the level 12 boss
Yes.
will squash you
Right.
if you don't have the shield of happiness, right?
Yes.
The sad thing is I knew exactly, when you said video games, I knew exactly where you were going with that, because we are both
nerds.
nerds. That's right. Yes. Well, thanks. Thank you, nerd, blank slate nerd, for being on the podcast once again.
Thanks, Bryan.
I also want to remind you to rate and review us wherever you're listening to this podcast. If you have suggestions or comments, please visit theoperatory.com and drop us a line. Again, I'm Dr. Bryan Laskin, host of the Operatory. Thanks for listening. I look forward to speaking with you next week.